Question 1. In the context of sterile technique when establishing a sterile field in the operating room, or which of the following steps is crucial in preventing contamination? A. Placing sterile items on a non-sterile drape. B. Ensuring that the sterile drape covers all surfaces, including the edges of the table. C. Moving sterile items across non-sterile areas. D. Disposing of sterile items immediately after use. Answer. B. Ensuring that the sterile drape covers all surfaces, including the edges of the table. Explanation. In maintaining aseptic technique, the sterile field must be meticulously created to prevent contamination. One essential principle is ensuring that sterile drapes fully cover all surfaces of the operating table, including the edges, to avoid inadvertent contamination. The sterile field should be regularly monitored throughout the procedure to ensure that non-sterile objects or individuals come into contact with the sterile area. Option is incorrect because sterile items must never be placed on non-sterile surfaces. Option C is incorrect because moving sterile items across non-sterile areas can lead to contamination. Option D is incorrect as sterile items are not typically disposed of unless contaminated or used, but rather stored for reuse in many settings. This is aligned with the guidelines set by the Association of Surgical Technologists asked for sterile technique and infection prevention. Question 2. Mr. Jackson, a surgical technologist, is setting up for an orthopedic procedure in a trauma setting. The surgical team is planning to use a pneumatic tourniquet to control blood flow during the operation. What must Mr. Jackson do prior to the application of the tourniquet? A. Verify the patient's consent for tourniquet use. B. Ensure that the cuff is properly inflated before placing it on the limb. C. Confirm the patient's medical history for any known allergies to anesthesia. D. Check the maximum inflation pressure and ensure it aligns with institutional protocols. Answer. D. Check the maximum inflation pressure and ensure it aligns with institutional protocols. Explanation. In trauma settings, the use of a pneumatic tourniquet is common to control blood flow and prevent excessive bleeding. The correct inflation pressure is crucial for both the efficacy and safety of the procedure. Surgeons and surgical technologists must ensure that the pressure does not exceed the recommended limit, as excessive pressure can cause nerve or damage. Institutional protocols will typically provide specific guidelines on the maximum inflation pressures based on the patient's size, condition, and procedure. Option is important but not a direct action before tourniquet application. Informed consent is obtained before surgery, not necessarily in the immediate preparation phase. Option B is incorrect as the cuff should be inflated after placement, not before, to avoid unnecessary risks. Option C is relevant for general anesthesia, but it does not address the primary concern in this scenario of ensuring safe tourniquet usage. Question 3. Scenario-based. Mrs. Harris, a 45-year-old patient, is undergoing a laparoscopic cholecystectomy. During the procedure, the surgeon requests that the surgical technologist retrieve a 10 mm laparoscopic trocar from the sterile field. The surgical technologist notices that one of the trocars has a small, unsterile spot on the outer casing. What should the surgical technologist do in this situation? A. Proceed with using the trocar, ensuring it does not touch the sterile field. B. Inform the surgeon and ask for a replacement trocar. C. Discard the trocar and proceed with the surgery using another one. D. Sterilize the trocar in the operating room and use it. Answer. B. Inform the surgeon and ask for a replacement trocar. Explanation. In surgical practice, any item that is not completely sterile should never be used in the operating field. In this case, the unsterile spot on the trocar's outer casing compromises its sterility, which is a critical factor in preventing surgical site infections. The correct response is to inform the surgeon and ask for sterile replacement. The sterile field must remain in, and there should be no compromises in maintaining aseptic technique. Option is incorrect because using an item with an unsterile spot compromises the sterile field, posing risk of infection. Option C is incorrect as the correct protocol is not to discard the trocar without consulting the surgical team, especially when replacement is needed. Option D is incorrect because sterilizing the trocar in the OR is not feasible or time efficient once the item is already considered unsterile. Properly sterilized items must be used instead. This decision aligns with infection control guidelines and best practices outlined by organizations such as the AST and CDC in maintaining sterile technique and preventing cross-contamination. Question 4. During a general surgery procedure, the surgeon requests that the surgical technologist prepare a sterile instrument set. The technologist opens the sterile pack, but notices that some instruments have slightly been touched by non-sterile hands during the setup process. What should the surgical technologist do next? A. Immediately discard the entire sterile set and prepare a new one. B. Re-sterilize the instruments before use in the procedure. C. Discard the affected instruments and use the remaining sterile instruments for the procedure. D. Inform the surgeon about the contamination and prepare a new sterile set. Answer: A. Immediately discard the entire sterile set and prepare a new one. Explanation: sterility is paramount in the operating room to prevent infection. Any contamination, even minor, of sterile instruments compromises the integrity of the sterile field. The appropriate response in this case is to discard the entire set as it has been breached. Aseptic technique requires that only instruments from an untouched sterile set should be used. Re-sterilizing items in the operating room is not a standard practice due to the time it would take and potential risks. Option B is incorrect because re-sterilizing instruments is not practical in this scenario. Option C is incorrect because if any part of a sterile set is compromised, all items in that set should be considered unsterile. Option D is partially correct in acknowledging the contamination, but a new sterile set must be prepared, not just a report to the surgeon. This response is in line with the AST standards and guidelines for maintaining sterile technique. Question 5. In the preparation for a laparotomy, which of the following actions is not essential to ensuring proper skin antisepsis? A. Shaving the area to be incised immediately before the procedure. B. Using an antiseptic solution to cleanse the skin starting from the center and working outward. C. Allowing the antiseptic solution to dry before draping the patient. D. Applying the antiseptic solution using a sterile applicator without any direct contact with the skin. Answer: A. Shaving the area to be incised immediately before the procedure. Explanation: proper skin antisepsis is critical to reducing the risk of infection. The goal is to eliminate or reduce bacteria on the skin surface before surgery. Shaving the incision site immediately before the procedure, option A, is not recommended because shaving can irritate the skin and increase the risk of microabrasions, which can facilitate the entry of pathogens. If removal is necessary, it should be done at least 24 hours before surgery or using a clipper, not a razor. Option B is correct as the skin should be cleansed with an antiseptic starting at the incision site and moving outward in a circular motion. Option C is correct because the antiseptic should be allowed to dry to maximize its antimicrobial effectiveness. Option D is correct as sterile applicators should be used to avoid contamination from non-sterile materials. This aligns with infection control guidelines to minimize surgical site infections, SS, as recommended by the CDC and AST. Question 6. During a cardiac bypass surgery, the surgeon asks the surgical technologist to handle the coronary artery grafting (CAB) procedure. The surgical technologist notices that the vessel being used for grafting has some signs of potential embolism. What should the surgical technologist do? A. Proceed with the grafting as planned, ensuring the graft is used quickly. B. Inform the surgeon of the possible embolism and suggest discarding the affected vessel. C. Continue the surgery without notifying the surgeon as the graft will be effective. D. Immediately perform a diagnostic test on the vessel before continuing with the grafting. Answer: B. Inform the surgeon of the possible embolism and suggest discarding the affected vessel. Explanation: in surgical procedures, particularly with cardiac bypass (CAG), the use of viable, healthy vessels is critical to prevent complications such as embolism. If a vessel shows signs of potential embolism or other compromised features, it should not be used. The surgical technologist's role includes recognizing these signs and communicating them effectively to the surgical team. Option is incorrect because continuing with the procedure could lead to severe complications, including blockage of the graft and subsequent failure of the bypass. Option C is incorrect as it ignores the potential for complications that could arise from using compromised graft. Option D is incorrect because while diagnostic tests might be useful in some situations, the immediate course of action should be to inform the surgeon and discard the affected vessel to ensure the best patient outcome. This aligns with surgical standards and guidelines related to vessel handling in cardiac surgery. Question 7. Scenario-based. Mr. Roberts, a 63-year-old patient, is undergoing a total knee replacement surgery. The surgical team is preparing to use a tourniquet to control blood flow during the procedure. The surgical technologist, noticing that the tourniquet has been applied for an extended period of time, is unsure whether it should be released. What should the surgical technologist do? A. Release the tourniquet immediately without consulting the surgeon. B. Consult with the surgeon about the appropriate timing for tourniquet release. C. Increase the pressure of the tourniquet to ensure better blood control. D. Leave the tourniquet in place until the surgeon instructs otherwise. Answer: B. Consult with the surgeon about the appropriate timing for tourniquet release. Explanation: in total knee replacement TKR surgery, the application of a tourniquet is common for controlling blood flow and ensuring a clear surgical field. However, prolonged use of a tourniquet can cause tissue damage and increase the risk of complications like nerve injury. The surgical technologist must consult with the surgeon regarding the timing of release. Tourniquet time limits are generally specified in surgical guidelines to minimize risks to the patient. Option is incorrect because premature release of the tourniquet could disrupt the procedure, potentially leading to excessive bleeding. Option C is incorrect because increasing pressure on the tourniquet is dangerous and could lead to tissue ischemia. Option D is incorrect as it implies a passive role, but the technologist should be proactive in seeking clarification from the surgeon to avoid complications. This response adheres to clinical best practices regarding the safe use of tourniquets in orthopedic surgeries. Question 8. During a neurosurgery procedure, the surgical technologist notices that the sterile field has been inadvertently breached by a non-sterile item. What is the most appropriate course of action? A. Allow the surgeon to proceed with the surgery and address the breach after the procedure. B. Inform the surgeon immediately and take steps to re-establish the sterile field. C. Remove all sterile items and replace them with new sterile items. D. Continue to work in the unsterile area as long as no direct contact is made with sterile instruments. Answer: B. Inform the surgeon immediately and take steps to re-establish the sterile field. Explanation: in neurosurgery, maintaining a sterile field is critical due to the high risk of infection. Any breach in the sterile field must be addressed immediately to minimize the risk of introducing pathogens. The surgical technologist should inform the surgeon and take action to either re-sterilize the affected area or replace contaminated instruments and supplies. Option is incorrect because delaying action on a breach in the sterile field could lead to serious postoperative infections. Option C is incorrect because it is not necessary to remove all sterile items unless they have been directly contaminated. Option D is incorrect because continuing to work in a breached sterile field can lead to contamination and surgical site infections. This aligns with infection prevention protocols established by the CDC and NAST. Question 9. During a cesarean section, C-section, the surgical technologist notices an unusual amount of bleeding. What should the surgical technologist do to ensure proper management of the situation? A. Immediately call for additional surgical instruments without discussing the issue with the surgeon. B. Continue the procedure as planned, assuming the bleeding is normal for a C-section. C. Communicate with the surgeon about the bleeding and prepare for potential interventions such as hemostatic agents or sutures. D. Document the bleeding but refrain from taking any immediate action. Answer: C. Communicate with the surgeon about the bleeding and prepare for potential interventions such as hemostatic agents or sutures. Explanation: in any surgery, especially in procedures like C-sections, excessive bleeding can occur. The surgical technologist's role includes promptly identifying and addressing potential complications. If bleeding seems excessive or abnormal, the technologist must communicate this to the surgeon, who may need to apply hemostatic agents, additional sutures, or other interventions to control bleeding. Option is incorrect as requesting additional instruments without understanding the cause of bleeding may not address the root issue. Option B is incorrect because while some bleeding is normal during C-section, excessive or unexpected bleeding warrants immediate action to prevent complications. Option D is incorrect as documenting the situation is important, but it should not delay taking necessary actions. This decision follows the AST guidelines for managing complications during surgery to maintain patient safety. Question 10. The surgical team is preparing for an abdominal surgery, and the technologist has placed an antibiotic solution in the sterile field to irrigate the surgical site. What is the correct procedure for handling the antibiotic solution during the surgery? A. Leave the antibiotic solution in the sterile field until the procedure is finished. B. Discard any remaining antibiotic solution after use, regardless of the amount left. C. Place the remaining antibiotic solution back in the supply area for future use. D. Ensure that the antibiotic solution is labeled and handled according to institutional protocols for medication disposal. Answer: D. Ensure that the antibiotic solution is labeled and handled according to institutional protocols for medication disposal. Explanation: proper handling of medications, including antibiotic solutions, is critical in the operating room. Any unused portion of the antibiotic solution must be properly labeled and disposed of according to institutional protocols to prevent errors and contamination. Medications must never be reused once opened, as they can become contaminated. Option is incorrect because it is not safe to leave medications in the sterile field after the procedure. Option B is partially correct but fails to highlight the necessity of following institutional protocols for disposal. Option C is incorrect because antibiotics cannot be reused once they have been opened for surgical use. This process follows FDA and institutional standards for safe medication handling in the OR. Question 11. During a laparoscopic cholecystectomy, the surgeon asks the surgical technologist to prepare the endoscope for use. Upon inspection, the technologist notices a small crack in the endoscope lens. What should the surgical technologist do next? A. Inform the surgeon and proceed with the procedure using the cracked endoscope. B. Immediately replace the endoscope with a new one and inform the surgeon about the defect. C. Attempt to clean the lens to remove any obstructions before using it. D. Proceed with the surgery as the crack is too minor to affect the procedure. Answer: B. Immediately replace the endoscope with a new one and inform the surgeon about the defect. Explanation: endoscopes are critical for laparoscopic procedures and their proper functioning is vital for the success of the surgery. A cracked lens can compromise the visual field, potentially causing difficulty during the surgery or increasing the risk of complications. The surgical technologist should immediately replace the defective equipment and inform the surgeon to ensure the highest standards of patient safety are maintained. Question 12. In preparation for a total hip replacement (EHR) surgery, the surgical technologist is tasked with ensuring that all sterile instruments are ready for the procedure. However, upon inspection, the surgical technologist finds that the sterile drapes have been placed incorrectly. What should the surgical technologist do? A. Proceed with the draping as it is and inform the surgeon after the surgery. B. Immediately stop the procedure and reorder all sterile drapes. C. Correct the draping and ensure the sterile field is maintained before proceeding. D. Continue draping without addressing the incorrect placement as it does not pose a risk. Answer: C. Correct the draping and ensure the sterile field is maintained before proceeding. Explanation: maintaining a sterile field is essential to prevent infections, especially in joint replacement surgeries like EHR. If the sterile drapes are not properly placed, there is a risk of contamination. The surgical technologist should correct the draping while ensuring that no contamination occurs and then inform the surgical team of the correction to maintain a safe sterile environment. Question 13, scenario-based. A 45-year-old patient is scheduled for a thyroidectomy. The surgical technologist notices that the patient has a history of hypothyroidism and the surgeon has specifically requested the use of a special scalpel for this procedure. What is the correct response? A. Use the scalpel immediately without confirming its specifications with the surgeon. B. Confirm the scalpel specifications with the surgeon to ensure the correct type is used. C. Inform the surgeon that the patient's condition might affect the use of the scalpel. D. Proceed with the standard scalpel and disregard the special scalpel request. Answer: B. Confirm the scalpel specifications with the surgeon to ensure the correct type is used. Explanation: the correct surgical instruments are critical to a successful procedure. In the case of thyroidectomy, specialized tools may be necessary due to the delicate nature of the thyroid gland and the risk of injury to surrounding structures. The surgical technologist should verify the scalpel's specifications to ensure it meets the surgeon's requirement, especially considering the patient's hypothyroid condition, which may affect healing or response to incisions. Question 14. A surgeon is performing a laparotomy on a patient with gastrointestinal bleeding. During the procedure, the surgical technologist notices that the patient is losing blood rapidly. What steps should the surgical technologist take? A. Notify the surgeon immediately and prepare for blood transfusion by ensuring that the blood bank has the required blood type. B. Continue with the surgery without notifying anyone, as the bleeding is part of the procedure. C. Attempt to stop the bleeding by applying pressure with sterile gauze. D. Wait until the surgeon asks for blood and transfuse it at that time. Answer: A. Notify the surgeon immediately and prepare for blood transfusion by ensuring that the blood bank has the required blood type. Explanation: In situations of rapid blood loss during a laparotomy is essential to address the situation immediately. The surgical technologist must alert the surgeon about the excessive bleeding and prepare for potential interventions, including notifying the blood bank to ensure that the correct blood type is available for a transfusion. Timely communication and action are key to preventing hypovolemic shock and other complications related to blood loss. Question 15. The surgical technologist is preparing a sterile field for a spinal fusion surgery. The surgeon requests the use of a special tool that the surgical technologist is unfamiliar with. What should the surgical technologist do? A. Proceed with preparing the sterile field and assume the tool is similar to others already on hand. B. Inform the surgeon of the unfamiliar tool and ask for clarification before proceeding. C. Ignore the unfamiliar tool as it likely will not be needed for the procedure. D. Use the tool without asking for clarification as the surgeon requested it. Answer. B. Inform the surgeon of the unfamiliar tool and ask for clarification before proceeding. Explanation. It is essential that the surgical technologist be fully familiar with all instruments used in surgery to avoid errors and ensure patient safety. If the technologist encounters an unfamiliar tool, they should immediately ask the surgeon for clarification before proceeding. Communication is crucial, and verifying the use of any unfamiliar instrument helps prevent mistakes that could lead to complications. Question 16. A patient undergoing a cesarean section has a previous medical history of hypertension. The surgical technologist notices that the patient's blood pressure has dropped significantly during the procedure. What is the most appropriate action for the surgical technologist to take? A. Continue with the procedure as planned, assuming the low blood pressure is temporary reaction. B. Notify the surgical team about the change in blood pressure and prepare for potential interventions. C. Attempt to raise the patient's blood pressure by administering fluids through the through and in without consulting the physician. D. Wait for the anesthesia team to address the blood pressure issue while continuing with the surgery. Answer. B. Notify the surgical team about the change in blood pressure and prepare for potential interventions. Explanation. A significant drop in blood pressure can indicate a serious complication during surgery, such as hemorrhage, anesthesia issues, or organ dysfunction. The surgical technologist should immediately notify the entire surgical team, including the anesthesia provider, to address the situation quickly. Waiting without taking action jeopardizes the patient's safety. Question 17. Scenario-based. During a knee arthroscopy procedure, the surgical technologist notices that the suction device is malfunctioning and not properly removing fluid from the surgical site. What is the best course of action? A. Inform the surgeon and attempt to fix the suction device during the procedure. B. Immediately replace the malfunctioning suction device with a backup and inform the surgeon. C. Wait until the surgeon notices the issue and then provide a solution. D. Continue with the procedure and work around the malfunction by using other tools. Answer. B. Immediately replace the malfunctioning suction device with a backup and inform the surgeon. Explanation. During procedures like knee arthroscopy, maintaining a clear surgical field is crucial for visibility and safety. A malfunctioning suction device should be addressed immediately. The surgical technologist should replace the malfunctioning equipment with a backup and inform the surgeon of the situation. This ensures that the procedure can continue without compromising patient safety. Question 18. A neurosurgical procedure is underway and the surgical technologist observes that the patient's blood pressure is fluctuating widely. The surgical technologist notices the anesthesia provider is not responding to these fluctuations. What should the surgical technologist do? A. Continue to monitor the situation and document the fluctuations. B. Increase the pressure in the anesthesia machine to stabilize the patient's blood pressure. C. Notify the anesthesia provider immediately and suggest possible interventions, such as adjusting medications or fluids. D. Ignore the fluctuations, as they may be normal response during neurosurgery. Answer. C. Notify the anesthesia provider immediately and suggest possible interventions, such as adjusting medications or fluids. Explanation. Blood pressure fluctuations during neurosurgery are concerning and can indicate underlying issues that need to be addressed promptly. The surgical technologist should notify the anesthesia provider and work with the team to adjust medications or fluids as needed to stabilize the patient. Ensuring that the blood pressure remains within safe range is critical to prevent complications. Question 19. During a laparoscopic appendectomy, the surgical technologist notices the presence of an incidental finding that was not anticipated. What is the correct procedure to follow? A. Inform the surgeon immediately and prepare to address the finding if necessary. B. Continue the procedure without mentioning the finding to avoid any disruption. C. Document the finding in the patient's medical record without informing anyone else. D. Remove the incidental finding without consulting the surgeon, assuming it is harmless. Answer A. Inform the surgeon immediately and prepare to address the finding if necessary. Explanation. Incidental findings can arise during surgery, and it is critical for the surgical technologist to notify the surgeon immediately. These findings may require additional steps or a change in the surgical plan. The technologist should be prepared to assist in addressing the issue, ensuring that any necessary follow-up or intervention is done in a timely manner. Question 20. A vascular surgery is being performed, and the surgical technologist notices that the surgical team is having difficulty controlling bleeding from a vessel. What should the surgical technologist do? A. Attempt to control the bleeding by using a clamp without consulting the surgeon. B. Notify the surgeon immediately and prepare additional hemostatic agents or tools. C. Ignore the bleeding if it seems minor and continue with the procedure. D. Attempt to apply pressure with sterile gauze to stop the bleeding. Answer B. Notify the surgeon immediately and prepare additional hemostatic agents or tools. Explanation. Controlling bleeding is critical during vascular surgery to prevent complications such as hemorrhagic shock or organ damage. If the surgical team is having difficulty controlling the bleeding, the surgical technologist should notify the surgeon immediately and prepare additional hemostatic agents or tools, such as clamps or cords, to manage the situation effectively. Question 21. During a cardiac bypass surgery, the surgeon requires the use of a specific vascular graft that is not currently available in the sterile field. The surgical technologist knows that the graft is stored in the back of the operating room. What should the surgical technologist do? A. Inform the surgeon immediately leave the sterile field to retrieve the graft and return as quickly as possible. B. Wait for the surgeon to ask for the graft before retrieving it from the back of the operating room. C. Notify the circulating nurse to retrieve the graft from the back of the operating room and bring it to the sterile field. D. Proceed without the graft and attempt to complete the procedure with the available materials. Answer C. Notify the circulating nurse to retrieve the graft from the back of the operating room and bring it to the sterile field. Explanation. If a required item is not on the sterile field, the surgical technologist should notify the circulating nurse to retrieve the necessary item from outside the sterile field. This maintains the sterility of the operative area, which is crucial to prevent contamination. The surgical technologist should continue to the surgeon while ensuring the sterile field is upheld. Question 22. In preparation for a lumbar laminectomy, the surgical technologist notices that the surgeon prefers a particular type of retractor that is not immediately available in the sterile field. What should the surgical technologist do? A. Use an alternative retractor that is available without informing the surgeon. B. Immediately inform the surgeon about the unavailability of the preferred retractor and offer alternatives. C. Proceed with the surgery without mentioning the issue, assuming the surgeon will adapt. D. Call the circulating nurse to retrieve the retractor, leaving the sterile field temporarily. Answer. B. Immediately inform the surgeon about the unavailability of the preferred retractor and offer alternatives. Explanation. The surgical technologist should communicate clearly and promptly with the surgeon about any unavailability of critical instruments. Offering alternatives, when possible, ensures that the procedure continues without unnecessary delays. This proactive approach helps maintain efficiency and patient safety, particularly in surgeries requiring precise instrumentation like a lumbar laminectomy. Question 23, scenario-based. A patient undergoing colorectal surgery has a history of severe allergies to latex. The surgical technologist notices that latex gloves are being used in the sterile field. What is the most appropriate response? A. Continue with the procedure as planned, assuming the latex allergy is not severe. B. Alert the surgical team immediately, remove the latex gloves and replace them with latex-free alternatives. C. Proceed with the surgery without taking action, as latex gloves are rarely an issue. D. Inform the circulating nurse after the surgery that latex gloves were used during the procedure. Answer. B. Alert the surgical team immediately, remove the latex gloves, and replace them with latex-free alternatives. Explanation. Latex allergies can be life-threatening, so it is critical to address any use of latex in the operating room immediately. The surgical technologist should alert the surgical team, remove any latex gloves, and ensure that latex-free gloves are used to maintain patient safety. Timely intervention is crucial in allergic reactions during surgery. Question 24. During a shoulder arthroscopy, the surgical technologist notices an issue with the sterile draping around the shoulder area. The drapes have shifted, and there is now a portion of the patient's skin exposed. What should the surgical technologist do? A. Ignore the exposure as it is not directly in the surgical area. B. Correct the draping while maintaining sterility and ensure the exposed area is covered properly. C. Inform the surgeon that the area is exposed but continue with the procedure without fixing the draping. D. Wait for the surgeon to notice the issue before taking any action. Answer. B. Correct the draping while maintaining sterility and ensure the exposed area is covered properly. Explanation. The surgical technologist is responsible for maintaining the sterile field, and exposed skin can lead to contamination and increase the risk of infection. Correcting the draping immediately and ensuring that the exposed area is properly covered is essential to maintaining a sterile environment throughout the procedure. Question 25. Scenario-based. During a bariatric surgery, the surgical technologist observes that the patient's body mass index (BMI) is higher than anticipated, making it more difficult to visualize the surgical site. What action should the surgical technologist take? A. Proceed with the procedure as planned, assuming the increased BMI will not significantly affect the surgery. B. Inform the surgeon of the difficulty in visualizing the surgical site and ensure the appropriate tools are available to manage the procedure. C. Delay the procedure to reassess the surgical plan considering the patient's BMI. D. Attempt to use different positioning techniques without informing the surgeon. Answer. B. Inform the surgeon of the difficulty in visualizing the surgical site and ensure the appropriate tools are available to manage the procedure. Explanation. Obesity can present challenges during surgery, including difficulties in visualization and maneuvering. The surgical technologist should inform the surgeon about the issue and ensure that additional tools or positioning adjustments are available to enhance the surgeon's ability to perform the procedure effectively and safely. Question 26. A patient is undergoing gynecological surgery, and the surgical technologist notices a change in the patient's condition, including low oxygen saturation and a rapid heart rate. What should the surgical technologist do? A. Continue with the procedure and wait for the anesthesia team to address the issue. B. Immediately notify the surgeon and anesthesia team about the change in the patient's vital signs. C. Try to stabilize the patient by adjusting the anesthesia settings without informing the anesthesia team. D. Ignore the signs, assuming they are normal for this type of surgery. Answer. B. Immediately notify the surgeon and anesthesia team about the change in the patient's vital signs. Explanation. Changes in vital signs, such as low oxygen saturation and rapid heart rate, could indicate complications such as hypoxia, blood loss, or anesthesia issues. The surgical technologist must immediately notify the surgeon and the anesthesia team so that the problem can be addressed promptly. Quick intervention is essential, maintaining the patient's safety. Question 27. Scenario-based. A laparoscopic cholecystectomy is underway, and the surgical technologist notices that the laparoscope is fogged, obscuring the surgeon's view. What is the correct action? A. Ignore the fogging and proceed with the surgery as it is unlikely to cause any issues. B. Quickly attempt to clean the lens while maintaining the sterile field, informing the surgeon about the issue. C. Inform the surgeon and suggest proceeding without the laparoscope until the issue is resolved. D. Continue with the procedure while assuming the surgeon can manage without a clear view. Answer. B. Quickly attempt to clean the lens while maintaining the sterile field, informing the surgeon about the issue. Explanation. Clear visibility is essential during a laparoscopic procedure. If the laparoscope becomes fogged, the surgical technologist should clean the lens quickly while maintaining the sterile field and inform the surgeon of the issue. Resolving the issue without unnecessary delays ensures the procedure can continue effectively and safely. Question 28. In preparation for a nephrectomy, the surgical technologist prepares the necessary instruments and supplies. However, the surgeon requests a specific scalpel blade that is not on the sterile field. What should the surgical technologist do? A. Wait for the surgeon to request the blade again. before attempting to retrieve it. B. Notify the circulating nurse immediately to retrieve the requested scalpel blade and bring it to the sterile field. C. Inform the surgeon that the blade is not available and proceed with a different blade. D. Ignore the request for the scalpel blade as it is not crucial for the procedure. Answer: B. Notify the circulating nurse immediately to retrieve the requested scalpel blade and bring it to the sterile field. Explanation: in nephrectomy, the proper instruments are critical for the success of the surgery. If a requested scalpel blade is not on the sterile field, the surgical technologist should notify the circulating nurse to retrieve the necessary blade, ensuring that it is brought to the sterile field promptly. Timely communication ensures surgery proceeds smoothly without unnecessary delays. Question 29. During a spinal fusion procedure, the surgical technologist observes a minor but concerning drape shift, which could expose the sterile field. What should the surgical technologist do? A. Wait for the surgeon to address the issue, as it might not affect the sterile field. B. Correct the shift immediately while maintaining sterility and inform the surgical team. C. Proceed with the procedure, assuming the shift is minimal and will not cause any issues. D. Leave the issue unresolved and inform the surgeon after the surgery. Answer: B. Correct the shift immediately while maintaining sterility and inform the surgical team. Explanation: a shift in sterile drapes can lead to contamination and increase the risk of infection. The surgical technologist should correct the draping immediately and inform the surgical team to ensure that the sterile field is maintained throughout the procedure. Proper draping is essential in preventing contamination during spinal surgery. Question 30. A surgeon is performing a thyroidectomy, and the surgical technologist notices that the patient's neck is becoming increasingly swollen, potentially due to airway compression. What should the surgical technologist do? A. Wait for the surgeon to notice the swelling and decide on the next steps. B. Immediately inform the surgeon and anesthesia team to assess for airway compression and take appropriate action. C. Continue with the procedure, assuming the swelling is a normal reaction. D. Attempt to relieve the swelling by repositioning the patient's head without consulting the surgeon. Answer: B. Immediately inform the surgeon and anesthesia team to assess for airway compression and take appropriate action. Explanation: airway compression is a serious concern during a thyroidectomy, and the swelling could indicate difficulty breathing or compromised airflow. The surgical technologist should immediately inform the surgeon and anesthesia team to assess the situation and take appropriate action to ensure the patient's airway is clear and properly met during the procedure.